Hello, class. My name is Morgan Foster, a senior at St. Petersburg College, pursuing a degree in Educational Studies and Community Leadership. Today, I am going to discuss the impacts a hearing impairment can have on a student within the learning environment. Let's begin. Defining a hearing loss does not stop at an individual who cannot hear. As determined by an audiologist, being hearing impaired is defined as an individual who cannot hear under 50 decibels without assistance. Although outward characteristics of this disability can parallel an auditory processing disorder, hearing impairment is not a disorder, but a definitive disability diagnosed by a professional. Hearing loss can be unilateral or bilateral, meaning in one or both ears respectively, and varies for each individual. There are three types of hearing loss. First is conductive hearing loss, which is a problem with the outer or middle ear. This includes what you see, the ear canal, bones, and eardrum. This type of hearing loss can be temporary, such as caused by an ear infection, or permanent, causing muffled hearing, and often can be corrected. For example, one may experience this with a common cold or allergies. The second type of hearing loss is sensory neural, which is problems with the inner ear. This includes the snail-like cochlea and auditory nerves. This is the most common type of hearing loss and cannot be corrected medically. For an individual experiencing this type of hearing loss, sounds are softer, unclear, and or distorted. Lastly, an individual could experience a mix of the two, which is deemed the third type of hearing loss. Although there is no true definitive answer to what causes hearing loss, it can be determined at birth or may present itself as an individual ages. Complications during gestation or at birth can cause congenital hearing loss or deafness. This may be caused by outside factors such as medications that damage the auditory nerves or other factors that remain unknown. Congenital hearing loss can also be linked to other disabilities such as Down syndrome or other genetic mutations. Every state in the country has a program to identify congenital hearing loss through early hearing detection and intervention programs. These programs are in place to screen for hearing loss before 1 month old and diagnose the type and degree of hearing loss by 3 months old. This principle is foundational to successful early intervention outcomes in speech, language, and literacy development. Viruses and infections such as mumps, measles, rubella, cytomegalovirus, and chronic ear infections are the most common reasons behind infant and child diagnosis known as acquired hearing loss or deafness. These factors can cause otitis media, which is a fluid buildup behind the eardrum that aids in acquired hearing impairments. It is estimated that nearly 3 out of every 4 children will experience some form of otitis media before the age of 3. Since ages birth through 3 are primitive years of language development, any form of hearing loss will be problematic for speech and language development, even if it's for a short period of time. Although more and more infants are being screened for hearing loss, there is no significant prevalence of one ethnic background being diagnosed more than the other at this stage of life. In 2019, 1.7 out of every 1,000 infants screened showed some form of hearing impairment, with just about 6,000 being deemed with permanent hearing loss. Based on statistics, it is more common for a white male over the age of 60 to be hearing impaired than any other demographic. Children in countries with low to middle class economies are at a 75% higher chance of developing ear infections or other hearing impairments than its high class counterparts. Most children diagnosed with hearing loss are fitted with either a hearing aid, a cochlear implant, or the combination of both. Children who have conductive hearing loss will get fitted for a hearing aid within the first days or weeks of life. A hearing aid can be bone anchored or behind the ear, depending on the needs of the child. This helps amplify noises directly into the inner ear, as the outer or middle may not work properly. When there is sensory neural damage, a child would benefit from cochlear implants as their hearing will be minimal and need deeper input into the auditory system. Unlike hearing aids, which amplify sounds, a cochlear implant bypasses damaged proportions of the ear to deliver sound signals to the auditory nerve. These are the two technologies that directly impact the everyday living of persons with hearing impairments. Other assistive technologies that are provided to the hearing impaired community include a personal FMDM system and communication access real-time translation, or CART writers. A FMDM system is worn by a speaker, then transmits the sound directly into the hearing aid or cochlear implant. A CART writer is an individual who transcribes the content of what is being spoken. These two assistive technologies are commonly seen in the classroom when sign language interpretation is not available or needed. It is common to believe that children who are hearing impaired would communicate with sign language. However, nearly 95% of the hearing impaired children are born to hearing parents. Therefore, assistive technology devices are heavily relied upon and often remove the need to learn sign language. With properly fitted devices and other forms of intervention, it is possible for a child who is hearing impaired to speak in their native and other languages just as well as a child who is hearing abled. Sign language, American or otherwise, relies on facial expressions, hand motions, and body position to produce words and ideas for the hearing impaired to understand. It is important that even if a student typically communicates in this way, they are still being exposed to high quality language opportunities. Students who communicate with American Sign Language or ASL will often have a harder time understanding syntax as ASL does not translate word for word. When a child who is hearing impaired reaches school age, it is common for this child to be delayed in one or more areas. Therefore, a language and reading ability test is often administered. This standardized test is administered by a psychologist or a speech pathologist and encompasses the child's response to interventions and in-class performance. Once completed, the evaluation will create a foundation for the student's IEP or 504 plan. For example, a student who uses sign language as their main form of communication will need an interpreter or clear and concise written material for all classroom instruction. It is important to remember that not all students who are hearing impaired will receive an IEP, as their disability may not directly interfere with the learning process. With this said, all students who are hearing impaired will be able to receive a 504 plan under the Americans with Disability Act that ensures school settings and curriculum are accessible based on their needs. Many students who are hearing impaired can mirror interpersonal interactions of an English language learner when new to the language. The similarities run deep when looking at how an English language learner and a student who is hearing impaired interacts with the English language. These similarities include the areas of vocabulary, syntax, and phonemic awareness. Like an English language learner, a student with a hearing impairment will need an extensive amount of practice with each new word they learn. The task of manipulating syllables or sounds is foundational to develop language. Therefore, students with a hearing impairment and English language learners will need specific direct instruction in these areas. In order to do this, a teacher may pre-teach basic words, use compare and contrast methods, and use these words in context rather than a word and definition practice. By modifying curriculum content in this manner, the student is connecting known information with new knowledge. Once the student has learned the information in the above manners, a teacher may move onto a concept map. This is a beneficial tool for English language learners and students with hearing impairments alike. This process can help store and retrieve information in long-term memory, similar to reading new words in context. When inside the classroom, a teacher can easily accommodate all students who are hearing impaired. However, it may be easier said than done. Some easy accommodations include ensuring the student can see the teacher's face, avoid talking behind or with backs to the student is seated away from the AC vents, and have ample amount of light within the classroom. Inside the classroom, there are many hard surfaces. These hard surfaces are notorious for noise bouncing, creating an extra noisy environment for a student who is hearing impaired. Adding soft textures such as rugs, pillows, and tennis balls on chair legs can help reduce unnecessary noise distractions that may occur. Lastly, if there is a video shown in class, ensure captions are available. This will not only help students who are hearing impaired, but other learners as well. These accommodations will typically fall under basic classroom inclusion for students who are hearing impaired. However, could be a mandatory part of the student's IEP. Should a student who is hearing impaired qualify for an IEP, the following could help ensure equal access to quality education. Early intervention, a level of support that can happen at home or within the school environment. Typically, a student who is hearing impaired would receive this level of support prior to entering the school environment and may continue to use it throughout their life. Since a student who is hearing impaired may be delayed in language understanding, the size of expected knowledge, time needed to grasp instruction, input of instruction, output of knowledge, difficulty of tasks, and participation in class will be different than hearing-able peers. By using Miller's 9 as a guide, a teacher who has a student who is hearing impaired can follow some or all of the basic following modifications of instructions. Provide a study guide that goes along with the curriculum ahead of time, make direct eye contact when speaking, arrange group activities that can boost peer interaction and student understanding of the material, concept maps that are partially completed, allow for more time or a separate space for test taking, written curriculum or visuals that coincide with instruction, provide supplemental information that allows for reinforcing topics, and differentiating tests that may be shorter or more elaborate in directions. Here we have additional resources that are provided for teachers, educators, and guardians of persons with hearing impairments. The first is a checklist of classroom accommodations and modifications specific to students who are hearing impaired. This was referenced in the previous slide. The second includes an easy-to-read hearing milestone checklist for parents. These milestones can allow a parent to observe their child for any hearing impairment concerns. The last is a short video that allows one to experience what it may be like for a student using assistive technologies inside the classroom. Links to these resources are provided in the transcript of this presentation. The bottom line is that a hearing impairment is not a one-size-fits-all diagnosis. Students with a hearing impairment spend the majority of their school careers integrated alongside hearing-able peers and live a rather normal life. However, without early intervention, properly trained professionals, and an unending dedication to bridge learning gaps, a person who is hearing impaired will not be able to succeed.